project has yielded some results, there is still more to be done, as some households are unable to meet their side of the agreement. Chief Executive Officer of SAMALEX Solutions, Samuel Jabba, has helped North attain the status of open defecation free, a feat that needs to be applauded. But how do we replicate this in every corner of the country? Joining us via Zoom is the Chief Executive of SAMALEX Solutions to tell us how he was able to achieve this feat and how it can be replicated everywhere. First of all, congratulations. Tell us about this project.
Thank you very much for having me on your program. The Gamma project, as you rightly said, is aimed at providing household toilets to vulnerable income who otherwise would not be able to access improved toilets. And SAMALEX likely happens to be one of the sanitation contractors on the project. So after we were rolled up on the program in 2016, what we found out was that there were still a lot of households who are down there below the middle class and low income brackets. And these people are the most vulnerable who actually need the toilet facilities. So we reached out to them. We found out that even the 30% that is required by Gamma to be contributed to the households, these vulnerable people couldn't afford it. We visited some of the communities after some community engagement. We found out that they really need the toilet facilities, but they can't raise the required 30%. And it will amaze you that in this day and age, there are still communities that doesn't have household toilets. They don't have access to public shared toilets. It's amazing. About 80% of the community people don't have access to toilet. And because they don't have access, what they do is to defecate in the open. Some defecate in the bush, refuse dump, backyard, roadside. So it's an eyesore in the community.
Now, authorities at the Kintampo College of Health and Well-Being are calling on government and get fund to help in the completion of a hostel facility that has been abandoned by a contractor since 2007. According to authorities, the project will help in tackling the increasing cases of insecurity in the school, as well as reduce congestion. The facility, when completed, will provide accommodation for about 400 students. Now, the Bono East Regional Correspondent Anat Sabit visited the school and now reports.
The Kintampo College of Health and Well-Being, currently with a student population of about 4,500, can only accommodate 12% of its students due to the absence